Hello and welcome to Easy Medics Daily. Pneumonia is one of the most common and dangerous respiratory diseases in the world, affecting everyone from children to the elderly. If not caught and treated early, it can be life. So, in this video, we're going to break down everything you need to know: what pneumonia is, its causes, who's at risk, the symptoms to watch for, and how it's diagnosed, treated, and prevented. By the end, you'll have a clear, practical understanding of this serious condition. So, what exactly is pneumonia? It's an infection that causes inflammation in your lungs, specifically in the tiny air sacs called alveoli. Normally, these sacs are full of air, allowing oxygen to pass into your blood. But with pneumonia, they fill up with fluid, pus, and inflammatory cells. This blocks oxygen from getting into your bloodstream properly, which is why people with pneumonia often feel short of breath and have low oxygen levels. Pneumonia can be caused by several different things. The most common cause worldwide is a bacteria called Streptococcus pneumonia. Other bacteria like Haemophilus influenzae and Staphylococcus aureus can also be culprits. Then there are viruses. The flu virus, RSV, and even COVID-19 can all lead to viral pneumonia, which is particularly common in children and can sometimes lead to a secondary bacterial infection. There are also what we call atypical organisms, like mycoplasma, which usually cause a milder form of pneumonia. Lastly, non-infectious causes like inhaling stomach contents or chemical fumes can also trigger it. We can classify pneumonia in a few ways. One way is by where you got it. Community-acquired pneumonia is caught out in the world, while hospital-acquired pneumonia develops during a hospital stay. We also classify it by how it affects the lung. Lobar pneumonia affects a whole section, or lobe, of the lung. Bronchopneumonia is more patchy, and interstitial pneumonia affects the tissue between the air sacs, often seen in viral cases. Certain people are at a higher risk of getting pneumonia. This includes infants and the elderly, smokers, heavy alcohol users, and those who are malnourished. People with weakened immune systems, perhaps due to conditions like HIV, diabetes, or from treatments like chemotherapy, are also more vulnerable. So how does it all happen? An organism gets into the lungs, and your immune system immediately launches an attack. This causes inflammation, leading to that buildup of fluid and pus in the alveoli. Gas exchange gets disrupted, your body's oxygen levels drop, and that's when symptoms start to appear. This whole process explains why fast breathing and low oxygen are classic signs. The most common symptoms include a cough, which can be dry or produce phlegm, fever, and chills. Chest pain that gets worse when you breathe, shortness of breath, and feeling very tired. More severe signs to watch out for are very fast breathing, confusion, especially in older adults, blue lips or fingers, and low blood pressure. If you see these, it's crucial to get medical help right away. To diagnose pneumonia, a doctor will often listen to your chest for sounds like crackles and order a chest x-ray to confirm the infection. They'll also check your oxygen levels with a pulse oximeter. Treatment really depends on the cause and how severe it is. It might include oxygen therapy, getting enough fluids, and antibiotics if it's bacterial. The key is that early treatment saves lives. If left untreated, pneumonia can lead to serious complications like fluid around the lungs, lung abscesses, or even sepsis. But the good news is, it's preventable. Getting vaccinated, maintaining good nutrition, quitting smoking, and treating other infections promptly can all lower your risk. To wrap up, pneumonia is a common and serious illness, but it is treatable. Recognizing the symptoms early and seeking medical care is the most important thing you can do. Thanks for watching, and for more clear, reliable medical education, be sure to subscribe to Easy Medics Daily.